My name is Faiq Aziz and I'm a fifth year medical student from the University of Liverpool. This abstract is a presentation on the changes in cardiopulmonary exercise testing parameters, CPET, in adult congenital cardiac surgery, CHD, with an aim of identifying a need for structured prehabilitation and post-operative rehabilitation. This project was undertaken at Liverpool Heart and Chest Hospital under the supervision of Dr. Elen, Hughes and Dr. Reza, Ashrafi, who are both adult congenital heart disease clinicians at LHCH. Background. CPET is both diagnostic and prognostic. It contributes to clinical decision-making surrounding surgical intervention in patients with CHD. Cardiac surgery in adults with CHD is common, with up to 20% of patients requiring a revision of their primary repair and many requiring a first surgery in adulthood. There is little information available on the impact of surgery on a patient's CPET parameters and therefore whether surgical intervention translates into an improvement in functional capacity in patients with CHD. Methods. This was a prospective observational cohort study. 101 adult CHD patients who had cardiac surgery and CPET testing both pre-operatively and post-operatively were identified. A separate control group of 101 adults with congenital heart disease who had two separate CPETs but had not had surgery in the period between the CPETs were identified. A range of CPET parameters were collected, comparing pre- and post-operative results, and these were then compared with a control cohort. Statistical analysis was performed, reporting p-values to assess whether observed differences in CPET were significant between cohorts. Results. Parameters such as peak VO2, which reflect functional capacity, showed preservation of exercise capacity when compared to controls over time. Parameters reflecting cardiovascular response, such as O2 pulse, also showed relative preservation when compared to controls. Ventilatory efficiency showed improvement following surgical intervention when compared with controls. In conclusion, cardiac surgery in adults with CHD was associated with preservation in CPET parameters when compared to a control group, suggesting that cardiac surgery may slow deterioration in functional performance, but not necessarily improve functional performance. CPET alone may not fully represent surgical success, suggesting a need for a broader outcome measure reflecting symptom burden and functional status following surgery. Given the evidence supporting structured prehabilitation and post-operative rehabilitation in improving functional capacity, surgical intervention should be considered alongside these strategies to improve long-term functional capacity, rather than as a standalone treatment. Thank you.